I've come way up here to socially distance because the COVID comeback is on. Well, there's no sugarcoating it. The latest stats when it comes to COVID in Cobb do not look good. And to get the latest, as always, we go to Dr. Janet Memark. She's the head of Cobb and Douglas Public Health.
You know, if anybody's paying attention, we're seeing a sharp rise like we're seeing throughout the United States. So we're not alone in all of this, but what's concerning is that we have some lower vaccination numbers than the nation and in certain areas. And so what we're seeing right now is that we have a 200% increase in COVID cases in the last 14 days and then a 58% increase over the last 7 days, and that's in Georgia. What we're looking at for Cobb County, we're at 399 cases per 100,000. And we're seeing a lot more positives coming back than we had anticipated previously. And so there's just a huge amount of activity right now in COVID, and that is being driven by the Delta variant that we've talked about before. So this is much more contagious, over 200% more contagious than the original strain, and it is going after unvaccinated folks as a majority right now.
One thing we're always concerned about in these cases is not only the rise in COVID, but how it affects the hospital system and how the hospitals are able to keep up with normal operations during a time like this.
Yeah, so you know, I don't have the details on the operations of the hospital, but I know that they are continuing doing elective surgeries at this time. But what they are seeing is they're seeing just huge increases in COVID. And so in our Cobb County district, we're seeing over 600% increase in COVID cases than we had just a few weeks ago in June. And so beds are either low or critically low across the board for ER, medical, surgical, and for critical care. And so this is, you know, we're seeing this all over again. It is the people that are there, they're younger than they were previously. You remember it was the 70s and 80s plus that we had hospitalized, and unfortunately we lost to death. What we're seeing now is people that are more in their 40s, 50s, and 60s, and 93% are unvaccinated right now that are in the hospitals that we're seeing.
Saw in the newspaper today that a number of COVID cases are already popping up in schools, not just here in Cobb, but all over Metro Atlanta. And I know we've received a lot of calls and emails from parents about what they should be doing. And it's a difficult situation for you, but what would you be advising parents today?
So we are seeing a lot of school activity right now with COVID cases. And so, you know, if what I need to tell everybody is that, you know, this is across the board for schools and not in schools. Whenever you're indoors right now, people need to be wearing their masks, regardless of vaccination status. I saw a lot of crowds this weekend, a lot of people that were not masking up. And so we all need to mask up right now when we're in the schools. And additionally, I would consider if you have other options, if your children have any sort of chronic disease or especially respiratory conditions, that then probably being in-person school is probably not the safest time right now while cases are so high. We are seeing an increase in the number of cases that we're seeing in under 18, and we're seeing an increase in hospitalizations as well. And that's throughout the nation, but especially in the southeast with the fact that people are not vaccinated and children can't get vaccinated. So please send your children to school that with their masks on or with masks, because it's very important as we try to bring these cases down.
You mentioned you went out and you didn't see people with masks on, and there's not a lot of social distancing seemingly going on as well.
And so, you know, that's concerning to me, because here we are again. This is our fourth surge, and I think it's going to really rival our worst surge in the winter time. You know, we have to do what we have to do to bring this down, and we have to wear our masks, and we got to try to keep distance. And so what I'm seeing is that we're having a lot of large crowds that are coming together, and they're just not wearing their masks. And so it's going to make it extremely hard for us to beat this. And I'm reading some, you know, this is not coming from the CDC quite yet, but that, you know, that there's another variant out there that could challenge our vaccines at this point. And none of us want to go through that. So the things that we have to do right now is please get your children and yourselves vaccinated if you're not 12 and younger. We are very fortunate. We have widespread vaccinations available that I'm hearing people within 2 hours can get vaccinated. You can walk into any of our public health sites right now at Marietta, Smyrna, Douglas, and Ackworth. You can walk in and get vaccinated. It is readily available and it's free. Get vaccinated, or you have to wear your mask, and you have to wear your mask. So everybody needs to be doing that right now.
This pandemic's had its share of buzzwords that have come out of it, but breakthrough cases is like the latest one. And what are breakthrough cases, and what does that tell you about the effectiveness of vaccines?
So that's a really important point. So what we are seeing is that there are so many cases right now that we are seeing the numbers of breakthrough cases come through higher than we anticipated. A breakthrough case is anybody who's fully vaccinated, so 2 weeks after your second vaccine dose, or 2 weeks after your Johnson & Johnson, if you got that one, that you would actually become positive for COVID. You know, there's a lot of information out there right now, and they're collecting more and more data on this. It's not just people that are asymptomatic without symptoms. We are seeing people that are having symptoms, and if you do the math, 93% of people hospitalized are unvaccinated. That makes 7% that actually are vaccinated that maybe didn't mount a response for some reason. Remember, if you are older or if you have any immune conditions that would make it difficult for you to mount an immune response to the vaccine, that makes you vulnerable. And so we are seeing, you know, and this is right within the realms of what we were told, between 90 and 100% effectiveness of this vaccine. You're seeing 90 to 100% that are protected against hospitalization and death. And so it is very important, but we are still seeing this spread. And so when you're out there, please don't tell yourself that, you know, oh, it's just allergies, or oh, it's just this. It's probably COVID at this point. You need to get yourselves tested and check and see if that's what it is, because you can be spreading it. And I'm telling you, this is as low of a vaccination rate that we have right now. This can go on for quite a long time before we get a handle on it.
Another thing you heard about breakthrough cases is even if you were vaccinated and got COVID, you wouldn't get as sick or die. Is that still holding up?
It is still holding up. And so what we're seeing, when we just look at the numbers from the state that they released, we had over 4.2 million people that were vaccinated, and we had 9,500 that tested positive for COVID at all, and we had only 0.004%, or 169 people at that time, this was last week, that were admitted. So 0.004% of that. And so, and only 93 that died, and that was 0.002%. So these are extremely low numbers. It is still extremely rare. And so that's why it's so important to get vaccinated. It may not protect you from, you know, actually contracting it, but man, it's doing a really good job of protecting you from hospitalization and death.
So when you said earlier that this surge may eclipse the prior one, that will probably scare a lot of people to death, because I think you get that everybody is frustrated and sometimes angry about having to go through these protective measures again.
Yeah, and I'm there with you. I'm tired as well, and I can't believe that we are here again. But I reviewed today some data that we're seeing from Florida and from Georgia, and you compare them, you know, we're following right in the footsteps, and they are having record-breaking hospitalizations. I just don't see anything holding us back from that unless we make some significant changes. And so, no, I don't want to see it either, but these hospitals are full right now, and we are seeing a lot of cases. And so you all can tell me what's going to make this go away if we don't do anything.